Any surgery can feel like a terrifying experience, but this is especially true for cataract surgery because we all know how important vision is. Now, I have realized that it is the fear of the unknown that is the cause for the lot of fear and anxiety which the patients experience on the day of surgery. So in today's video, I want to explain everything in detail regarding what to expect on the day of your surgery, such as how much is the waiting time, what are the clothes that you should be wearing, what are the documents you should be carrying. And so stay tuned for that and make sure you watch the video to the very end so that you are completely prepared and have a safe, uneventful and a stress-free surgery. So let's start right at the beginning. On the day of your surgery, when you wake up, make sure to have a light breakfast or a light lunch before you leave for the hospital. Most of the cataract surgeries are done under topical anesthesia, and as a result, we don't need our patients to be fasting. And so you can definitely eat something, and this is particularly important if you are taking any kind of medications for certain systemic diseases. This brings us to my second important point regarding medicines. Now, if you are someone who is suffering from diabetes, hypertension, heart disease, thyroid disease, or any other systemic disease for which you're taking medications, make sure you take those medicines even on the day of your surgery, unless it has been specified otherwise by your physician. Now, why is this important? Now, if you are a diabetic and you have not taken your medication on the day of your surgery, and if your blood sugar level is higher than the expected range of normal, your surgery might have to be postponed. Similarly, if you are a hypertensive and not taking your antihypertensive medications, then your blood pressure will be higher than the acceptable levels, and as a result, your surgery would be required to be postponed. So make sure you are not skipping any medications on the day of your surgery. Now, the next most important thing is that you keep a file with all your hospital related documents, your insurance documents, your ID card, and other things ready prior to the day of the surgery. So you are not in a rush and you're not searching for things on that particular day. Also, it is mandatory that you have a relative or a friend or a person along with you on your surgery day. Now, there are multiple reasons for this. The first important thing is the surgical consent form requires the signature of not just the patient, but also the person who is coming along with the patient prior to the surgery. Another thing is that it is a surgery and you don't want to be alone prior to your surgery. You need someone along who will make you laugh, who will take your mind away from the fact that you're going to be undergoing a surgery. Also, an attendant or a relative will be able to buy any drops or medications which your doctor advises, and they will be able to transport you from your home to the hospital and take you back home after the surgery. So make sure that you have someone along with you on the day of your surgery. I will also be making a detailed video on what to expect or what you need to do prior to your cataract surgery. So make sure to click that bell notification so that you are alerted whenever that video comes up, and you can have a look at that video as well. And it will be a very useful video and it will give you a detailed guide on what you need to do prior to your cataract surgery as well. Now, once you reach the hospital, the first thing that happens is the admission process. And during this process, you will be asked to provide your identification card, fill out certain details, and also you will be explained regarding your surgery. Now, this process in itself can take anywhere between 20 to 30 minutes. So make sure that you are arriving at the hospital at least an hour prior to your surgery. Once your admission process is completed, you and your relative or your friend will be directed into the waiting area, and this is the place where your dilatation process is started. Now, the dilatation process is the process where they put drops within your eyes so that your pupil is dilated, so that at the time of surgery, the pupil needs to be dilated fully so that your surgeon will be able to easily access the cataract. Sometimes the waiting time can even take longer, especially if the previous surgery or the surgery which was happening prior to yours is taking longer than expected. And you will be informed accordingly by the various hospital nurses or attendants who are around if that is the case. So don't worry about it. You just need to keep calm and wait for your turn. Now, once it is time for your surgery, you will be led into the operation theater. Now, prior to entering the operation theater, you will be given certain clothes into which you have to change, or even a OT gown which you can wear over your own clothes. Now, this is why it is important that you should wear something which is light and airy, or something which is easier to remove and wear again, something which you are comfortable in. So, once you have entered into the operation theater, it is going to feel a lot colder than outside. Now, this is because the OT temperature is maintained at a certain level for the optimal functioning of the various machines, and also to prevent any kind of fogging of the instruments. So, you might feel colder, but don't worry about it. Certain blankets and other things will be provided for you so that you will not be feeling cold during your surgery. Assistant will guide you to the operation theater bed, where you will be told where to lie down, where to place your head, and how to lie down in the correct position. You will be assisted constantly. If at any point you are feeling uncomfortable or anxious, just convey that to the people around you and they will take care of you. Once you have been laid down onto the operation theater bed, there will be sterile drapes which have to be put over your face and your eyes, because we want to avoid the risk of infection. So these sterile drapes might cover your entire face, and you might get anxious because of that, but don't worry, you will be able to breathe with no difficulty. And if at any point you do feel that you're feeling uncomfortable, just let the assistant know and they will lift the drapes higher and make sure that you are much more comfortable. Now, at the time of surgery, your doctor will be constantly talking with you. They will be asking you what you're feeling, asking you to look at a particular bright light. So, you need to make sure that you are keeping both of your eyes open and looking straight up into the light that they want you to look at. Avoid trying to close your eyes, because this causes the eyes to roll upwards. Also, a speculum is placed in the eye at the time of surgery. So when you try to close your eyes, what happens is that the speculum will try to prevent the closing, and this can also cause pain to you as the patient. Now, during surgery, there are certain sounds that you will be hearing, which is basically the ultrasound phaco machine doing its job. So, don't get scared when you hear a lot of sounds during the surgery. Secondly, you might feel water trickling around your eye area. Don't worry, those are medicines, and the water is basically being used to treat your eye. So just keep calm, keep looking at the light, and your surgery will be over within 10 to 20 minutes. Now, one thing I like to tell my parents is that count from 1 to 100. By counting from 1 to 100, it helps them to get distracted, and it also allows them to calm down further. So you can try that too on the day of your surgery. Just mentally count from 1 to 100 while you keep looking at the light. Finally, avoid any sudden movements or coughing. If you feel the urge to cough, or if you feel uncomfortable in any way, let your doctor know by speaking to them, because there will be sharp instruments inside your eye, and it is better to avoid any sudden movements during the surgery. If you really need to cough, just tell your doctor. They will tell you when it is safe for you to cough. So don't worry, we won't stop you from coughing. Once your doctor has finished with the surgery, you will be escorted into a waiting area where you can rest and recover from the surgery. At the same time, you will also be explained regarding the various eye drops that you need to put for the coming 1 month, and also the various do's and don'ts that you need to follow after your surgery. I will be making a separate video on the various do's and don'ts following cataract surgery. So make sure to keep an eye out for that video by clicking on the bell notification and by subscribing to this channel. Hope you guys enjoyed this video, and I will see you all again very soon in the next video. So stay healthy, keep those eyes healthy and safe, and bye-bye.